So hospitals here in Florida are starting to see an uptick in numbers. While there are people that are coming in with COVID symptoms, it doesn't mean that the rest of the medical conditions are staying at home. People with heart attacks, strokes, kidney stones, and just your basic cuts and trauma injuries are still coming to the emergency department for emergent medical needs. So our population in the emergency department is starting to increase a lot more. We're just starting to see a lot more people with COVID-19 as well. While the virus is going on, this shouldn't preclude you or prevent you from coming to a hospital. If you're still experiencing symptoms of chest pain, shortness of breath, difficulty ambulating, or traumatic injury, this isn't the time to stay at home despite the virus going on. We still encourage you to come to the emergency room to seek medical care, as some conditions are really time dependent. So, as an emergency room physician, I'm on the front lines with this virus. We see patients on all parts of the emergency room, both in our COVID units and on our medical side, both with kids, adults, and adolescents as well. My involvement is definitely on that front line, trying to take care of patients. Obviously, trying to hold a little bit of judgment, making sure that I'm well prepared for this patient interaction. This includes wearing a mask, goggles, gowns, gloves, making sure I have the protective equipment that I truly need to not only keep my patients safe, but my staff as well. And then coming home to a family is also important as well. What does that look like? There's been a lot of shifts from the way we used to practice just 6 months ago to today, but we are starting to take those precautions and making sure that we're all keeping each other safe. This virus is not going away currently. Many parts of the country are starting to see decreases in numbers, but Florida and several other states throughout the nation are seeing an uptick. This is our time as citizens to be very cautious, not only to get ourselves sick, but to prevent other people from getting sick as well. This is definitely a group and a herd effort to make sure that we're keeping each other in line and making sure that we're all safe and healthy during these times.